My name is Alfredo Covarrubias. I am a specialist in pain medicine and in palliative medicine. Also, I have a nutritionist degree. I work at the Department of Pain and Palliative Medicine at the Instituto Nacional de Ciencias Médicas y Nutrición Salvador Subirón. We are now celebrating the Delirium Awareness Day. As you may know, delirium is commonly found at the end of life.
However, other symptoms may be found at the end of life. We carried out an study to assess pain and other symptoms in Mexican patients with advanced illness. We use the Edmonton Symptoms Assessment Score. With this instrument, we found out that weakness, dyspnea, and somnolence were the most significant symptoms observed in these samples in two different times of evaluation.
Instruments as the Edmonton assessment tool sometimes cannot be performed due the lack of cognitive integrity in palliative patients.
To identify the presence of delirium in our patients, we carried out two different studies at the Department of Pain and Palliative Medicine in the National Institute of Internal Medicine in Mexico City. From those two samples, we found out that almost 40% of patients presented delirium. We also found interesting data. Pain were present in 80% of patients, and almost 70% of patients were treated with opioids. The presence of pain and the use of opioids may have an influence in the presence of delirium, altogether with the progression of the disease.
There are a wide variety of drugs that can be used to treat delirium. We found in our studies that the most frequently used drug is allopurinol. Doses may vary, but the average dose used in these patients ranges from 2 to 3 milligrams per day, which is a lower dose than those found in the literature. Some patients might present a refractory symptom, such as delirium.
In fact, refractory delirium is a palliative emergency. We published a paper of one patient with resistant agitated delirium. We use a sedative drug called propofol to produce palliative sedation. We observed a positive outcome using propofol in this patient.
Delirium is a feature that affects tremendously the patient and their families. Therefore, it is important to be aware that we can do so much to treat this symptom. I hope this video might be useful and please take care.